So I'm going to show you how to place an IV catheter in this leg. I'm going to walk through the steps of taping as well as the actual placement itself. So I am going to start off with my IV catheter. When you are placing an IV catheter, there is no need to stabilize the vein while you are placing. So make sure to keep your thumb away from the area, and that is to make sure that we are following strict aseptic technique and not introducing any bacteria into the site. At this point, I'm going to go ahead and insert my IV catheter, bevel up as always, and then I'm going to advance the catheter. And now at this point, once you've advanced and we're situated here, I'm actually going to occlude the vessel, and then I'm going to pull my stylet out at that point. I occlude to make sure that there is not a lot of blood coming back this direction when I actually have a patient and there's a lot of blood that might come back at you. So go ahead and place the T-port onto the catheter, and that's when you can let go. At this point, we are going to go ahead and flush, make sure that we are actually properly in the vein, which in this case we are. Once you know that you are in, go ahead and clamp off, and we're going to start with our tape. So as you know, I've ripped my pieces of tape into pieces. Dang it. As you know, I've ripped my tape into pieces for my first go. So I'm going to take one of my 1-inch pieces of tape, and I'm going to place it so that it is sticky side up and underneath the hub of the catheter. When you are holding your catheter, you want to make sure you're not putting too much pressure because you can actually kink the catheter at the insertion site. So we try to just be kind of gentle, keep it stabilized, but you don't have to push very hard. So I will fold it over, and then I will fold it over one more time, as you see here. Now when you're folding your tape over, we make sure that the tape for this beginning portion is not covering the insertion site of the catheter itself, as well as the flanges on the hub of the catheter. So we still want those to be visible during this portion of the taping. And this is when we're going to tape around the leg and then secure it. Always put tabs at the end of your tape to be nice to the people who may have to rip this catheter out later. So I pinch it down, make sure everything is nice and situated, and that is how your first piece of tape should look. At this point, I'm going to take my next piece of tape. This is going to be a full 1-inch piece of tape. And some people rip a little excess tab here in the side. You can, you don't have to, it's not 100% necessary, but people will do that so that the second piece, which is sticky side down, when you place it up underneath the catheter, it actually sits over the tape that you've placed previously. So at this point, you've got your second piece of tape snugged up underneath the catheter hub on top of the tape that you placed first, and then you're going to wrap your tape around. This is the point where you can cover the insertion site of the catheter with this piece of tape. So if your tape is too long, you can always rip off a little bit of it. No need to just wrap your patient with a million layers of tape. So this is your second piece of tape. This is how it should look. We pinch everything down, and you're good to go on that one. It's always good while you are placing an IV catheter to flush periodically while you are placing it to make sure that everything is still patent, there's been no movement. If the patient is moved, we want to make sure that there's no issue with the catheter. So at this point, you guys saw that my T-port kind of fell out. And in order to avoid that, we use the piece of tape. It is our second piece of the little 1/2-inch tape that we ripped earlier. So I am going to place sticky side up this portion around the injection hub. One side, I'm going to fold down the opposite direction, so that it looks like it has crisscrossed, and follow up with the same thing on the other side. So this anchors down the T-port so it is not easily able to come out of that catheter. So this is nice and situated now, and we will move on to our next piece of tape. So this piece of tape may be new for some of you, that you may not do this in practice, and that's okay. But here I would like you to perform this with this extra piece of tape. We place it sticky side down, and we place it so that it is basically covering anywhere where the injection port on the T-port itself is actually sitting on the arm. We do this for aseptic technique. We will be inserting many needles into this, and we want to make sure our patients do not get any infection from us. So we want to keep this as clean as possible. So we'll place that underneath the injection port and then wrap everything all around. And this piece of tape is where you can actually cover the full hub of the catheter. Like so. Now this is your very last part, securing the portion of the T-port onto the leg itself. I am going to place my male adapter port on the end of my T-port. I'm going to take my very last piece of tape. I'm going to place the tape sticky side down around this portion of the extension set on the T-port. So once I've done that, it's gonna curl naturally, and so I'm gonna just follow the natural curve of the extension set here on this T-port, and I will tape it down like so. You want to make sure you leave this outside of the tape. If you tape that in, you're not going to be able to clamp and unclamp. So you want to make sure that that is out. At this point, I'm going to wrap everything all the way around the leg. And I'm going to tape down straight over everything else and then pinch everything down. This is how your finished IV catheter should look. 5 pieces of tape. Your T-port is nice and available on all sides. Your injection port is covered, so there's less of a chance of inadvertent bacteria introducing into the area. And the bottom may not look as pretty as the top, but that is totally fine, as long as it's patent and our patient can get everything it needs. All right, everyone, thank you very much.